My name is Patty Kazar, and I am from Southern California, San Diego. I found out I had invasive ductal carcinoma in November of 2009. I found this out through a mammogram and then also an ultrasound. And they did a biopsy, and it was proven at that point that it was invasive ductal carcinoma. And then I was set up from the hospital and my physician to do the normal traditional protocol in America, which is surgery and chemo and radiation. And I wasn't comfortable with that. I felt in my heart of hearts that there was another way, there must be another way. And so I started to do research, and I found Dr. Simoncini's name from Dr. Mercola's website in Chicago. And I had printed that out, oddly enough, 2 years in 2007.
So even before you knew you had cancer?
Yes, yes. It was just an amazing situation. And I remembered printing this out, and so I retrieved it from my files, and that's when I began extensive research with Dr. Simoncini. And I just knew that this was something I wanted to delve into deeper and possibly treat myself with his method.
Now, let me ask you this. Before you decided for Simoncini, did you consider any other alternative treatment?
I had, through my research, I found out about a Dr.
Brzezinski, yeah.
Yes, in Houston, Texas. And Dr. Brzezinski still had a certain amount of traditional protocol, and I just did not feel comfortable with that.
So you just basically knew Simoncini was your choice?
Exactly.
Intuitively.
I had read about a lot of other treatments, doctors, their protocol, and not one of them felt as right as Dr. Simoncini's did. And after I made that decision to go to Rome, I was completely confident that this was.
Now, before you went to Rome, did you do any of the traditional protocols like chemo or radiotherapy?
No, I did no traditional methods whatsoever. I did not feel comfortable with any of those procedures. From all of the research that I did, it just didn't resonate for me.
So when did you fly to Rome?
I flew to Rome on March 17th, 2010, St. Patrick's Day, and I started my treatment on March 22nd, and I had treatment for 8 days in a row, and I feel the treatment was very simple, very easy.
This was injections in the breast?
Injections in my left breast. I was diagnosed with invasive ductal carcinoma, and the pain would last maybe 10 minutes or so and then go away. I was completely pain-free. And like I say, this went on for 8 days. And after, I asked doctor what the follow-up would be, and he said, in a month and a half, get an ultrasound, which I did, and that proved there was no growth, no problems that they could see at that time. And then every 3 months after that, I went in for an ultrasound to see what the process was and monitor it.
So how many ultrasounds have you done that resulted negative after the 8-day cycle?
I have had 6 ultrasounds from the 2010 until last year, and I just have gotten my CT scan, and they could not find any abnormalities
And
whatsoever.
this CT scan, what date was it? When was it done?
It was the last part of November of 2011.
11. So basically you went from April of 2010, you finished the treatment, and by November 2011, so a year and a half, you had at least 8 different checks and no more presence of cancer
No.
noticeable.
No, no.
Do you feel cancer is gone from you?
I do. I feel I'm cured. I really do. And I am extremely grateful to Dr. Simoncini for treating me.
Have you tried to go back to your original oncologist here and tell him what happened to you?
No, I did not go back to her. My primary doctor referred me out to a different oncologist, and he ordered a PET scan for me from the chin down to the knee to see if anything was going on, any metastasizing or any problems at all, and they didn't find anything. And I had gone back to him for a CAT scan, and that was in November 2011. And that CAT scan didn't mention anything about breast cancer or any problem. And I went for a follow-up consultation with him, and in the course of our conversation, he said, I asked him about my blood test. I showed him my comprehensive blood testing, and the reason I did is to show him the CA15 report. I asked him to also let me have a T-cell test. And he said, from this current blood test, there's no need for you to have a T-cell. Everything looks fine. Your lymph nodes are fine. There's no metastasizing. There doesn't seem to be any activity in your breast. And he said, are you sure that you ever did have cancer? And I said, well, I had a biopsy. And he said, well, you're looking good. You're looking real good. And he said, just keep up what you're doing. And I feel wonderful about it.